Hi, this is Tracy from NurseEdScholar. So today we're going to talk about IV fluids and how to use them. We hang them every shift as nurses, but if we choose the wrong type of fluids, we can really cause some major problems to our patients. The goal is always the same: restore fluid balance without harming the patient, and to understand how they work, how IV fluids work. We need to think about what happens to water movement in and out of the cell. So let's start. So first up is isotonic solutions. Iso means the same. So these fluids have the same concentration as blood plasma. So when we infuse them, water doesn't move in or out of the cells. It just expands in the intravascular space. So examples of isotonic fluids: your 0.9% normal saline. So we just call that normal saline, and lactated ringers. So when do we use these fluids? We use them to treat dehydration, hypovolemia, or replacement of loss of fluids, or loss of blood, like in GI bleeds. But one thing to remember with isotonic fluids, they're your go-to for resuscitation fluids because they don't mess with the cell size. So think of isotonic. The blood goes through the blood vessel, but it doesn't do anything to the cells. It just expands the intravascular space. So when a person loses blood, they give them that isotonic fluid to fill up where the blood was lost. Okay? So next, let's talk about hypotonic solutions. Hypo means low. So these fluids are less concentrated than plasma. When you infuse them in your patient, the water shifts into the cells, making them swell. So hypotonic solutions, when it infuses into the body, it goes into the cells to make them swell. So examples of hypotonic solutions would be 0.45% normal saline. We typically call that half normal saline. Sometimes D5W, but after it's metabolized. So when do we use hypotonic solutions? Well, we use them to treat cellular dehydration. Think about diabetic ketoacidosis, or hypernatremia, because in those states in your patient has lost a lot of fluid, and so the cells shrink. So you want to give them hypotonic solution, and as it goes through the blood vessels, it goes to the cells, and it makes the cells swell back up to their normal size. But remember, one thing of caution with hypotonic solutions, you know, if don't use them in a patient that's at risk of any kind of increased intracellular pressure, like head injuries, because the swelling of the cells in the brain is dangerous. It will cause cerebral edema. So you really have to watch out. You know, of course, we do what the provider, writes. But if you know these things and hey, hypotonic solutions will cause cerebral edema, and you have a person with a head injury, there is nothing wrong with calling the physician and saying, hey, are you sure you meant hypotonic? Okay. Um, Now let's go on to hypertonic solutions. Now, hyper means high. So these fluids are more concentrated than plasma. So when they go through the blood vessels, the water will shift out of the cells into the bloodstream, making cells shrink. So examples of this is 3% normal saline, a lot of salt, or 5% normal saline, or D10W, dextrose 10 water. So when do we use hypertonic solutions? Well, usually it's in critical care areas, and it's used for things like severe hyponatremia or cerebral edema. Think about what we just talked about. Cerebral edema, the cells in the brain have swollen. You give a person hypertonic solutions, it goes through the bloodstream and it pulls the water from the cells, shrinking the cells. Okay. One bit of caution with hypertonic solutions is that they can cause fluid overload because they're pulling all of the water out of the cells into the bloodstream, and cause pulmonary edema. So you really need to watch your patients very closely. Close monitoring is essential. So think hypertonic solution, think ICU settings. Patients are going to have central lines and frequent assessments. Okay. So let's recap real quick before we close. Isotonic stays put. So the fluid stays in the blood vessel. Hypotonic, the fluid goes in. Water moves into the cells and the cells swell. So patients with dehydration, we talked about that. Hypertonic solution, it pulls water out of the cells. Okay, it helps the cells shrink. So basically, that's it. Three types of fluids, three types of simple rules. So if fluids finally make sense, hit that like button, subscribe to NurseEdScholar for more simplified nursing content. And if you haven't already, check out my video on third spacing. I did that several months ago, but thousands of students have watched it to master fluid balance concepts. So see you in the next video, and thank you for watching NurseEdScholar.